Hello reception, hope you're all okay. I hope you're enjoying the snow and I hope you're getting on okay with your home learning. I've got another story to share with you about our topic this week. It's called Doctor and it's, what do you think it's about? A doctor, yeah, good guess. Okay, let's have a look inside. Doctor. Dr. Miranda works in a GP practice. She helps people feel better when they feel ill or have been hurt. Good morning, doctor, says the receptionist. What's a receptionist? Throughout the book, there will be some words that you might think, oh, I'm not sure what that means. At the end, we'll have a talk about those words. And then you can watch the video again, listen to the story with the words that you now know, okay? So, receptionist. Have a think what that might mean. You have lots of people to see you today, doctor. It's going to be a busy day. Dr. Miranda's first patient has a swollen ankle. Look, her ankle is all red and hot and sore. Okay. She feels Olivia's leg. Oh, it's okay, Olivia. Can I have a look? Asks Dr. Miranda gently. She feels Olivia's leg and ankle, asking where it hurts the most. Dr. Miranda thinks Olivia needs an X-ray. She tells Olivia's mummy to take her to the hospital. What is an X-ray? Do you know? We'll find out at the end. Just to make sure nothing's broken, says Dr. Miranda. Next, Dr. Miranda gives twin babies their injections. That's another word, isn't it? Injections. I wonder what that means. We'll find out at the end. She sees a boy with a bad case of chickenpox. Has anybody ever had chickenpox before? Have a think. She checks a pregnant woman's blood pressure. And she listens to a man's chest through her stethoscope. We already know what a stethoscope is because that was one of our words last week. Now, Dr. Miranda has to call patients who are too poorly to leave home. She asks them questions and then decides how to help them. Dr. Miranda is about to go and have her lunch when the receptionist rushes in. Oh, can you just see one more patient this morning, please, doctor? It's important. Jimmy has just arrived at the surgery for an emergency appointment. His daddy explains he has a cough and a high temperature. That means it's really hot. Dr. Miranda asks whether Jimmy has a rash or any other symptoms. Symptoms, that's another word we're going to look at the end. No, he's just been sleeping lots today, haven't you, Jimmy? His daddy says. Jimmy's not very happy, look. He doesn't feel very well. Dr. Miranda takes Jimmy's temperature with a thermometer. Then she looks in his ears with an otoscope. Say, ah, she tells Jimmy. Ah, says Jimmy, opening his mouth wide. Then she looks at the back of his throat, that's inside in the back of your mouth, with a very special stick. Next, Dr. Miranda asks Jimmy to sit on the bed and take his jumper off. Dr. Miranda listens carefully to Jimmy's chest using a stethoscope. We already know what they are, don't we? It feels cold and it tickles. Jimmy's having a giggle, look. Dr. Miranda thinks that Jimmy has a chest infection. That means he's got a poorly chest. She writes a prescription for some medicine. Sorry, that's the cat. Good girl. She writes him a prescription for some medicine and asks him to come back in a couple of days if he's not better. Prescription. A prescription. What's a prescription? You should feel very well again soon, she tells him, waving goodbye. Thank you, Doctor, says Jimmy. Dr. Miranda checks her afternoon with the receptionist. What a busy day it has been already. Dr. Miranda just has to make one more call before she can go out for lunch. Wow, she is a busy good doctor, isn't she? What else does Dr. Miranda do? She visits patients at her home. She sends people to hospital. She gives injections to stop people getting ill. And she gives people their test results. And these are all the things that Dr. Miranda needs to do her job. A stethoscope, a computer, the prescription pad, her tongue depressors, those are the special sticks, an otoscope, a thermometer and a telephone. That's the end. Okay, let's have a look at our words from the book. Okay, so the first one I've got is patience. Now, I haven't got a picture for that because it's a bit tricky. I couldn't find a good picture for patience. A doctor has patients. The patients are the people who are poorly or hurt and that the doctor helps, okay? So patience is our first word this week. The next one is otoscope. What's an otoscope? It's right, that's right, he's looking in the man's ears. Okay, they look to see if there's any swelling or if it's a funny colour. Okay. The next word is prescription. Prescription. A doctor writes a prescription for a patient when they need some medicine. Okay, so the patient then can go to the chemist and get their prescription. Okay. Thermometer. A thermometer, some of them look like this. Some of them are long and thin that you put in your mouth. This one you just point at your head and press a button and it tells you how hot you are. You've probably had your temperature done before. It tells you how hot you are because if you're very hot that means that you're poorly. Okay. Next one. Symptoms. Symptoms are how you can tell that you're poorly. So if you had a sore throat or a headache or you were hot or you had a cough, those are all symptoms. It tells us things that tell us we're poorly. Okay. Now the doctor checked a pregnant woman's blood pressure. So pregnant just means she's going to have a baby. Okay. And blood pressure, when they test your blood pressure, they use a special piece of equipment that they wrap around your arm, and they used to pump it up with a special pump, but now it's a machine and it makes a noise and it tests how your blood is moving around your body. Okay. Receptionist. Receptionist is the lady or man or anybody who answers the phone and greets the patients in a doctor's surgery. Receptionist. Injections. Remember the twins in the story were having their injections. So your injections are little needles that you have usually in your arm or your leg. They don't really hurt. That stop you catching nasty diseases and help to keep you healthy. You'll have probably all had injections when you were littler than you are now. Chickenpox. Oh, that poor little boy, he's ever so spotty. Chickenpox makes you have spots. Okay, it's an illness you get when you're little and it makes you have spots all over and they can be a bit itchy. Okay. But you do get better after a while. And the last one, X-ray. An X-ray, can you remember Dr. Miranda sent the little girl to the hospital for an X-ray? Well, an X-ray is a special photograph of your bones. So you sit on a special machine and they take a photograph, but it's not a photograph of your face or your body. It's a photograph of your bones using a very special, very big machine. So they can see whether your bones are broken or not. Okay, so those are all the words for that story. And I'll look forward to seeing you tomorrow. Take care. Bye.